Hey, good morning, MotoAmerica fans. Welcome to this latest edition of Off Track with Carruthers and Bice. I am Sean Bice, and I'm joined by Paul Carruthers, our communications manager here at MotoAmerica. And we are fresh off a Laguna Seca round and a couple weeks away from our return to Mid-Ohio after 10 years. And which is a fairly long time, the entire history of MotoAmerica, Paul. But you and I both went back there. It used to be there quite a bit back in the day. You'd go at least once a year, right?
Yeah,
To
I
Mid-Ohio.
I probably went there for the first time in '86.
Wow.
Probably went there every year after that, when I was with Cycle News. Yeah, we're excited to go back.
Yeah.
It's always cool. It was one of my favorites back then, so it's cool to be able to go back. There was obvious reasons why we couldn't race there in the past, but those reasons seems to have been fixed. So, yeah,
Yeah.
I'm looking forward to it. It seems Laguna Seca already seems like it was a long time ago for some reason. So,
Yeah, it does.
but
It
yeah,
does.
Mid Ohio is going to be good.
Yeah. So our guest today is Dr. Tom Bryan, MD, who, speaking of the 10 years of MotoAmerica, Dr. Bryan, I'm not trying to date you, Dr. Bryan, but you've been around for a while and actually been working with riders in the paddock since 2002. So even before AMA Pro Racing, back in the days of certainly AMA Superbike. And it's a who's who of who you've worked on over the years, or whether it's been to start with, whether it's been referrals, and it goes right up to the present day with riders we have now. So lots of things we can talk to you about. And the cool thing with you, Dr. Bryan, is you race, and you also are a bicycle mountain bike rider and a cyclist as well. So you fit in with Paul, certainly, and all of our riders. So it's great to have you on. Thank you.
Yeah, it's good to be here.
Yeah. Tell us, I want to start with you. Kind of, how did you get started being kind of this, an orthopedic surgery, by the way? I want to mention it's orthopedics. How did you get started in the paddock? Was it a rider that came to you first? Was there a pioneer? Because it's all word of mouth, of course, the way things go. And we've known that whenever a rider has something going on, at some point you seem to get involved with them. So tell us how it all kind of began, if you wouldn't mind.
Yeah, it began back in 2002, and actually Matt Mladen came to our physical therapy, and I'd been riding for a while. I had a Ducati, not a Suzuki at that time, but I got to know Matt, saw him as a patient, and you know, since that time, done several surgeries on him over the years. And at first, Matt's pretty quiet guy, as you know. He didn't really want to release who his surgeon was to anybody, and he certainly didn't want to tell competitive riders that he had a guy that rode sport bikes and was willing to take care of them in the appropriate manner. But eventually, word sort of leaked out. I took care of his friends like Damon Buckmaster and Marty Craggle at first, but then people started to figure out, I was around the paddock a lot with Matt, and they got to know me, and people started coming in and calling up, and that's, I enjoyed taking care of them. And I started doing track days right after that, and I was pretty diligent about becoming a better rider. I'd had a couple street crashes on a Ducati, and I wasn't really as skilled as I should have been. So I went and took several Schwantz schools. Back in the day, Kevin would have track school the day after the AMA races. Did it several times at Road Atlanta, a couple times at Barber, and I even got to do the Indianapolis Motor Speedway before the MotoGP event with Kevin. So that was a lot of fun. I also did Pridmore schools and Freddie Spencer schools and Keith Code, and I did a lot of fast track days out at Fontana, where a lot of the pros would come and warm up at the beginning of the season or preseason. So I got a lot of time on the track, and I really enjoyed that. And I did have a few get-offs to the track, but it's a lot safer doing that than in Azusa Canyon. You know what I mean?
I was going to ask you about that. You mentioned a couple of crashes. I mean, the more we ride, the more chance we have of crashing, obviously. What my question is, like, when you hurt yourself, who fixes you?
That's a good question. Most recently, I had a dirt bike crash in Lucerne Valley 3 months ago, and my partner, who's a hand surgeon and upper extremity surgeon, Dr. Rosemary Yee, fixed me. She's the same.
Okay.
She's the same one that did the recent surgery on Cam Peterson, which she's doing great, obviously, after that. So just depends what part of the body I injure, I guess. But for the clavicle, she was the one. I can choose different body parts for different partners. I've got 7 surgeons in the group and a couple podiatrists. So we've got a pretty wide variety of people that I can choose from.
Is the collarbone the most popular? Doesn't sound right, but is it the thing that most road racers or motorcycle racers injure?
It's very common. Most recently, Joe Roberts injured his. I had done his other side a couple of years back. This time he got it done in Assen so he could race the next week at the Nürburgring. But of course, I got the phone call in the middle of the night when it happened and we discussed it. But yeah, collarbones are pretty frequent. That's for sure.
It seems like I mean, obviously medicine's changed over the years, but back in the day, you couldn't race as quickly with a broken collarbone as they do today. Is that because back then they didn't necessarily plate them, or how does that work?
Yeah, we used to treat them non-operatively, and then some studies came out that showed that not only do they heal faster and they heal better, but they also give you more normal shoulder dynamics afterwards. Because if your clavicle shortens, your shoulder shortens, and all the muscle tension is off. So almost all of them we plate now, unless they're really minimally displaced. In terms of how soon we do it, the plates are better. They now have screws that actually lock into the plate, so they're less likely to get loose. They still get loose, especially if you crash. But that's, I guess, one of the things is more of the riders are going to doctors that will let them race after they plate their clavicle. That's FIM now as a rule that you can't race within 48 hours of general anesthesia. I think that dates back to when Jorge Lorenzo actually broke his collarbone at Assen and flew down to Barcelona and flew back and raced on Sunday.
Yeah.
So now it's 48-hour rule. So absolutely, I know Joe really wanted to race, but 48 hours is pretty strict rule. And doing a clavicle under local anesthesia, I think that would be torturous. I just don't think that that's something we could possibly do. Although we talked about it.
So it's a pretty good rule.
Yeah, I agree with it. I mean, the effects of anesthesia, you're not supposed to drive a car within 24 to 48 hours. General anesthesia, driving a car is a little different than driving a MotoGP or a Moto2 bike. Yeah.
Dr. Bryan, before I ask you this next question, I want to go back to the beginning. So you mentioned about Matt Mladen. So, I think you said you're originally from Illinois, right? Is that correct?
Correct. I'm from Chicago.
Okay. Chicago, that's right. But you've been in Southern California. So here you've got a guy who's a countryman of Paul Carruthers, or part of Paul Carruthers' country. I mean, he's an American now, but he's also an Australian. So Matt's from Australia. How did he discover you to begin with?
We had our office, we had a satellite office in Chino Hills that was pretty close to Yoshimura. And we had a large physical therapy facility that was, we treated a bunch of athletes there. I take care of a college football team, et cetera. So it was called Athletic Rehabilitation Center. And Matt's gym that he worked out at, LA Fitness, right across the street. So he found our physical therapy before he found me.
Okay. Yeah. And I mean, it's,
when we got to talking, I sort of heard the name, but I didn't really know who he was, even though he'd won the 3 prior Superbike championships. I didn't really know firmly who he was, but he obviously enjoyed talking to someone that understood the issues.
Well, that's the other thing I want to mention to you. I mean, he's over the years, especially lately, he's softened a little bit, but I mean, he was a hard ass when he raced. I mean, he was difficult to approach from a media point of view, even a fan point of view sometimes. You obviously had a rapport with him. Was he an absolute delight with you, or was he still kind of a badass when he worked with you a little bit?
No, I mean, he was nice to me. And, I mean, there's a lot of surgeons I work with, neurosurgeons, et cetera, that when they're in the zone working, they're badasses. And I probably in the operating room, I'm sometimes a badass.
You are.
So, I mean, I guess he could relate. I could relate. We had a great deal of respect for each other. And, I mean, I saw him at times doing things that I thought were, pretty hard-assed, but that was his racing style. And, but when we're just the two of us talking, he was totally fine. And, he was respectful. And, that was just part of his aura about him and made some other riders, fear him or respect him and think twice before diving under him in a corner. That's think 10 times before diving under him in a corner.
Yeah, it worked for him for sure.
Yeah. Yep.
So I also doing a little research this morning. Are you still the team ortho at Mount Sac?
Yeah, I've been the football team doctor there since 1986. Go way back.
It's funny because my son ran cross country in high school here in Southern California. So Mount Sac is, I don't know if to me, it seemed like, I remember it being like the biggest cross country race in the country. And so we used to go there once a year or twice a year sometimes. But yeah, it was always a very cool event with so many different runners. So it's funny. I saw that Mount Sac, it kind of triggered me a little bit to those memories, but that was fun times.
Yeah, it's a really good football program. We've had every few years we have someone who's a top NFL player. Right now, Rashad White, who's the starting running back for Tampa Bay, he played for us. And Antonio Pierce is the head coach of the Raiders and played in the Super Bowl with the Giants. He was our middle linebacker way back in the day. And Bruce Irvin played for us. He made history and was the first guy kicked out of a Super Bowl. And I thought it was pretty good because he punched Gronkowski. So I think if you're being a wimp, you're going to punch the littlest guy in the field. He punched Rob Gronkowski. So, you got to at least respect his choice of who to tangle with.
So football players versus motorcycle racers, is that a completely different list of injuries or is there crossover?
Oh, there's a lot of crossover. And, things like concussions, I'm very familiar with from football. And, we've learned a lot over the years about concussions and what you should do about them. And, motorcycle racers with concussions, I mean, if it's important because if they don't really know what they're doing, they're going to take a lot of people out with them, not just themselves. Whereas football, the guy's going to have a lifelong problem, but it's just going to be him. It's not going to, the other teammates don't rely on him. They're the same.
Man, I'll tell you, that thing about concussions was so prevalent. I mean, I think maybe because of the movie that had come out about it, and obviously with football, but even it touched us a lot. And I don't know that there are any fewer concussions happening in our sport. Maybe it is. Maybe helmets are getting better, but it was a obvious huge problem in that idea of repeatedly having it happen. I mean, I think I can mention, because it's a matter of record, Josh Day ended up not being able to race anymore after his third one in pretty close succession. So that become a little bit less prevalent, or is it kind of died down just kind of because of things that naturally sort of die down after a while?
Well, I think helmet technology has come a long way, but it's still not perfect. And I think the concussions sometimes are not necessarily flashed on the front page of the internet. That's kept kind of quiet. And there's always a question of whether or not someone is able to race. And, I used to let people race and let people get back in a football game that no way I would now. That's, now we know about, it's called second impact syndrome. When your brain really, like 4 to 6 months after you've had a good concussion, if you have another good concussion, it causes probably permanent damage. And concussion is such a colloquialism. Traumatic brain injury is really what it is. So I've had a couple myself. One on Mount Baldy Road. I had 4 hours I don't remember. I woke up in the CAT scanner, so never had a concussion on a motorcycle, but certainly did on a dirt bike. So that's something to think about.
Yeah, man, I'll tell you, that brings up something I've got to ask you. So, Dr. Bryan, you've been an avid motorcyclist and cyclist for a long, long time. You can recount several injuries that you've had. It hasn't stopped you. And unfortunately, sometimes when these guys end up in hospitals in areas, you get this, I hate to say this, but you hear some that, in the emergency room, they'll sometimes act like a motorcycle racer, or a motorcyclist is a quote organ donor, which drives me nuts. I hate that. So your idea, you do it and you continue to do it, even though you've gotten hurt yourself. Are you like a rider in that your passion for that sport sort of overcomes, what to be something that maybe isn't so good for your body sometimes?
I guess. I mean, I was on the USC rugby team, and so that was my action sport when I was younger. And that obviously had its own set of circumstances. And actually, that's how I met my wife. She was a spectator rugby game I was in. So when I do something dumb or something stupid, she gets what she asked for. I have to point that out to her. But that's I do think twice about it, and I've stopped doing track days. Some of it's because they tore down the Fontana track, which was very close to me and easy, and they're also doing a lot less, track days. Willow Springs, I went there several times, but that's pretty far away for me. So I've stopped doing track days and more doing the mountain bikes and enjoying cycling. A little less risky, but not completely less risky. And it's
You
still
got to have a little risk in your life, right?
You do have to have a little risk in your life. There's an old saying that boats are safest in the harbor, but that's not what they were made for.
Yeah.
So
Very true.
do your colleagues think you're nuts?
Kind of. Some of them do, but
Yeah.
okay. Because I used to be the young wild one in the group. I joined a group of 6 guys, and now I'm the senior partner with 9 of us. I mean, it's so yeah. Some of them do, but they understand. One of my partners plays hockey, and that's he gets a good one every once in a while. So at least I'm not the old.
I've got a question for you. It's obviously going to be it's probably the answer would be different based on the injury. But if me or Sean got injured and we came to you and we had a broken bone, we're not in a rush to get back, right? Do you treat that differently than a guy that has to race as soon as he can, or is it the same?
The collarbone, for instance, you might put a extra long plate on with has 2 extra screws, one at each end, just for a little bit of belt and suspenders. That is something you might do that you wouldn't necessarily do in a normal person that has time to heal. But I think when people come to me, they expect to be semi-bulletproof, which is obviously not possible, but I do the best I can. And I talk to each patient, and I'll also tell them, this type of surgery will take a certain amount of time to recover from, whereas that surgery won't. Like an anterior cruciate reconstruction, if an older person, by that I mean 35 and up, has a torn anterior cruciate ligament, you might not decide to fix that, but you'd still fix the meniscus, because the anterior cruciate ligament keep them out of work 4 to 6 months, whereas the meniscus might only keep them out a couple of weeks. So I think it's individual, and you discuss that with the patient. But I don't do a halfway job just because someone's not
No, right.
a pro athlete.
Yeah. And, I wanted to ask you, so we talked about collarbone, very common, but one thing that I remember years and years ago when Larry Pegram broke his femur, and I remember, Larry Pegram, he's the rider that broke his femur. I know so many riders that have now broken their femur. Garrett Gerloff, Sam Lockoff did it. Obviously, we just heard about Dallas Daniels doing it. And, it happens more than I thought for the bone that's supposed to be the hardest bone, as hard as, harder than concrete for that size of a structure. Is that more prevalent than it used to be?
Well, I think that riders, like Dallas did it on a motocross bike. Actually, his manager, Tommy Hayden, contacted me. He's sorry to contact me on a Sunday evening, but I was I was fine. And I looked at his pre-op X-rays, and I sent him some X-rays of what I would do to it. And I don't think they shared that with the surgeon, but then he sent me the X-rays the next day. He was at a trauma center, and it was a capable place for fixing the femur. And I saw his post-op X-rays, and I guess femurs usually stay where they happen. You don't have time to fly the person to see me. That doesn't make any sense either. But femurs, I don't think they're not that common. They're more common in motocross accidents and things like that, and street accidents, but I don't think they're that common in road racing. It's not. I know Michael Gilbert broke his at the Ridge.
Yes.
And I happened to know a surgeon up there, and made a phone call, and he was not available, because he told me he would be willing to go in, but he already had a couple cocktails on that Saturday evening, so it was inappropriate. So he had his associate do the surgery. So often when people break their femur, I don't obviously do the surgery because it needs to be done where they're at, but I follow it, and do follow-up x-rays and decide when they're able to race again. But I don't think it's that common. And Larry broke his hip. I've seen it. I'm following him. I didn't do his
Oh,
original,
okay.
but
Yeah.
I'm following him all the way from Ohio. He's one of the guys that says, tell me before you retire so I can get my, follow-up surgery done. And he's been saying that for the past 5 years. And I've been saying, no, I'm not going to retire. Don't worry, Larry.
Well, apparently neither is he.
Neither is he. I couldn't believe I saw him in flat track at Paris a few years ago, and then I saw him up at Laguna Seca. Yeah, neither is he. He's goes on forever. I mean, he's in great shape. He really is.
Yeah, he's good.
Yeah, and it's interesting about Larry. I don't think this is saying anything out of school, because I think he's publicly made knowledge about this. And when you say hip, I knew his hip. I actually thought his hip and femur were two separate injuries, but I do know that his hip injury has affected his mobility over the years a little bit. And to your point, maybe he eventually wants to get that sort of cleaned up a little bit. And Dr. Bryan, if you can talk about this, and I'm not sure, but you've had this situation with Matt, going all the way back to Matt. I mean, Matt famously had a ultralight accident, which affected his ankle to the point where it was almost immovable. And he even used a different foot peg. And I think he used a street style shifting to try to overcome all that. But even later on he would come back to you, wouldn't he? And try to get that improved. Yeah. Tell us about that.
Well, at the end of the season, several times I did arthroscopy on his ankle where I'd take the bone spurs out, and he had enough ankle motion that he didn't want to just do a fusion, and but it improved him. Yeah, but several times we did ankle arthroscopy on him, and yes, it bothers him to this day. But that's they do make ankle replacements, which are good for 70-year-olds that want to sit around and play the piano, but they're not really something that will hold up to a motorcycle racer. So it's tempting to say, oh, let's do a total joint replacement, but it's not something that's a durable solution. But yeah, Matt with his shifting foot was limited. Obviously, he was still pretty damn fast, but it did limit him, and it limited him with other sports. He's able to golf and ride a bicycle and things like that. But obviously, it's not an ideal situation. But I think injuries that happen off the track, I mean, that's just the way it goes. Those things happen. That's part of being a motorcycle racer.
I don't know if you keep records of stuff like this, or if you can even tell us, but is there one guy that's seen you the most?
It might be Matt. It might be Matt.
Wow.
Yeah.
I thought you were going to say, I mean, I guess maybe because I talked to Josh Hayes enough. I mean, gosh, he's got hand things. He's got foot things. He did his fib at Barber. I mean, he's got a lot of broken bones all over his body and hardware and things like that. But I mean, he's been to see you a few times, I think, hasn't he?
Yeah, I've done his last few surgeries, but I wasn't his surgeon for a lot of the stuff that he did early on. But I've been the one that's put him back together lately. And obviously the one where he had the injury in Alabama, he came out here and we fixed him up, and that went quite well. He was able to win 2 more races and become the winningest racer of all time. So obviously that was important to him. And he's such a great guy. He really great guy, and his wife Melissa. They're great people.
Yeah, it was funny, Paul. So when we were at Laguna and I saw Dr. Bryan, we were sitting at a table having a conversation up with the VIPs, and in strolls Melissa, and I knew she had this done, but she rolls up her sleeve or something and shows she's one of very, very few women in this world, I think, that has a scar from having arm pump surgery. Isn't that right, Dr. Bryan? I mean, it's a little unusual.
Yeah, it's very unusual for women to have arm pump surgery. I treat a lot of female athletes, but like soccer players don't get arm pumps, so that just doesn't happen. And even I have bicycle racers that are my patients, and that doesn't happen to them either. So it's pretty specific for motorcycling.
Well, now that we brought up arm pump.
Yeah.
I mean, it seems like it's such and it kind of goes in waves, right? I mean, it's like all of a sudden everybody's got arm pump, nobody's got arm pump, half the guys have arm pump, but it's obviously, as you point out, it's not only motorcyclists, but it's a lot of motorcyclists. Is it just the constant motion of using that?
Well, there's certain tracks that really cause it. I mean, three times someone after Road Atlanta called me up and said, I'm coming in. So Road Atlanta,
Wow.
a big track for arm pump. Fontana was too, but that one's not there anymore. But Road Atlanta seems to be the biggest one. So it's I think, you know, when you're decelerating from a very fast speed to a slow speed, you know, obviously you try to dig your knees into the tank and not use your arms to decelerate, but you know, there's no way you can do that, you know, with the big bike. A lot of times people move from the 600 to the big bike, and that's the time where their arm pump really flares up. And I think as the bikes have gotten more powerful and heavier, you know, not necessarily heavier, but more powerful, that there's more arm pump with that. So, you know, and arm pump is kind of a generic term, but it's compartment syndrome is, you know, the real medical term for it. And compartment syndromes happen in trauma. Say you break a bone, it'll bleed into the compartment and it'll swell up, and that'll cut off the blood supply. But in the case of racing, you know, the blood pumps into a compartment. You got compartments in your arm that the muscles are surrounded by a really like thick canvas-like layer called the fascia. And the blood pumps in at 120 millimeters of mercury, but the veins go out at 40 millimeters of mercury. So what happens is, as your muscles pump up, pressure builds in that compartment, and if it gets above 40, usually about 70, the blood keeps pumping in, but it can't pump out because the veins are compressed. And that's when the arm starts to swell and the nerves then get compressed. And so the standard surgery we do for that is fasciotomy, or arm pump surgery, where we actually open up the fascia. And that doesn't solve everything. I mean, I think you've seen recently, it doesn't solve everything, because a lot of times the nerves are also getting irritated by the muscles pumping up. So arm pump surgery is a little bit controversial. I was having a long discussion, you know, with the doctor in the MotoAmerica Medical Center about arm pump surgery, and you know, I've done it on, you know, probably a dozen guys that are currently racing, and you know, we were discussing the indications for it, and I have to say that I never discussed with someone the pros and cons. There's usually someone calling me up and say, I'm coming in, you know, I want to have it done. And they talk to other racers and decide whether to have it done. So, you know, it's a surgery you can recover from pretty quickly, but you do leave a big scar, and, you know, the fascia that you divide can grow back, you know, and I've done a few where I've gone back in on someone that had it 10 years ago by somebody else, and released it again. And that usually is helpful, but it's not 100%. It's not like it takes care of all the symptoms. It just makes it enough better to be worth doing.
Yeah, I mean, we had Sean Dillon Kelly on, and he talked with us about this, Dr. Bryan. So I know that you know this situation. He had it done, and then he had to have it done again, or something related to it again, because he's got such scar tissue that builds up that it actually kind of sounds like it healed itself and created the problem again. Maybe the same one, if not maybe the worst one. Maybe you can explain that to us.
Yeah, well, I did his surgery on both of his arms, and it was done in the off season, and I'm not sure doing it during the season and having the arms swell up again, that may make the fascia grow back in a more loose fashion. I'm not sure, but he had a history, he said, of scarring happening. Whenever he got cut, he'd always get big time scar tissue, and he didn't get it in his left arm. The left arm was fine, but the right arm, he developed a whole lot of scar tissue. And when he's racing over in Europe, they redid it over there. And, you know, so obviously he's doing pretty well now, but they removed a big piece of scar tissue that had formed. It wasn't, you know, first thing we do is divide the fascia. We don't necessarily take all of it out. So he had a bit more extensive procedure over there.
Oh, so you don't just cut it. So I'm picturing, you said it like canvas. I'm picturing it, you cut it once. You actually segment it a couple times. And before you respond to that, I want to ask you, is this a bit like your appendix? We have a thing that we don't really need, because it's weird that you can cut it, but it doesn't have any effect, or does it? I mean, it has a good effect, but any bad effect?
You know, it does decrease your grip strength a little bit. You know, most of the racers that have it they're not weak to begin with. In fact,
Right.
it might be due to muscle overgrowth. You know, there's a doctor in Wyoming that's trying to inject Botox into the muscles to weaken the muscles so it doesn't happen. So the fascia does serve a purpose, and that it holds the holds all the muscles together, and when the muscle contracts, it makes it actually do its job. So it does have a purpose. It's not something that, oh, prophylactically we should just, anyone wants to become a racer, we should cut their fascia. That's certainly not the case. And if someone only has arm pumps certain times and once in a while, they're not a candidate for surgery. But obviously, if someone's in the middle of a championship race and they need to have it done, they need to have it done. But the appendix, the thing on that, we take it out. If you're in the belly for something else, you take the appendix out, because a lot of things can mimic appendicitis. And if you don't have an appendix, it can't happen. But the fascia does serve a purpose. It does serve a purpose.
Do we have a fascia in our thighs or in our calves or anywhere else?
Oh yeah, runners. The chronic exertional compartment syndrome is much more common in runners than the upper extremity would be. So lower extremity, it's pretty common in runners, where the muscle.
Okay. How about weightlifting? These guys get so muscle bound and big. How do they grow muscle like that with this fascia holding things back, or does that not do that?
I think the fascia can gradually stretch, over time. And weightlifters, it's not like they're going from 150 miles an hour to 30 miles an hour using their arms to decelerate. They gradually build it up over time.
Okay.
So I've not seen that. I have seen guys that had a big bruise on their thigh or something from dropping the weights on them. They can get a compartment syndrome from that.
Wow.
But not from just bulking up. I've not seen that.
Yeah. That sounds like, to me, not to get terribly medical, because I don't even think I stayed at a Holiday Inn Express last night, and I can't even say that I've got that going for me, but that's a hematoma, isn't it? That's a buildup of blood that creates pressure in your leg, is what you're saying, if you get an injury.
In that case, yes, it's a buildup of usually blood. And that's in a trauma situation where you break a bone, it's blood and bone marrow that go into the compartment. But it's clear fluid and inflammation fluid in a case of a racer.
I see. Okay. And kind of in concert with that whole compartment syndrome is a situation that I'm surprised that I don't think Paul's ever had this. I have never had it, with the amount of typing that we do on keyboards, but it's something that secretaries used to get, which is carpal tunnel. And carpal tunnel seems to be a situation with riders. It causes their hands to numb. And how do you know whether it's compartment syndrome or carpal tunnel? Does it all go together?
Yeah, that's a good question. And I've done carpal tunnel in conjunction with arm pump surgery in several cases. And a couple times guys have come back years later and we've done the carpal tunnel. Carpal tunnel affects certain fingers, and there's a certain test for it, which sometimes it's very obvious. Carpal tunnel, you can also do, it's called an EMG, a nerve conduction study, where they put little electrodes in and they measure how long it takes for the electrical impulse to go across your wrist, across the carpal tunnel. Obviously, that's, a test that's invasive and, not necessarily very fun. So a carpal tunnel release does decrease your grip strength also, because that the tendons that flex your fingers go through the carpal tunnel. So we don't just do a carpal tunnel in everybody that we do arm pump on, but yeah, in several situations, if you're talking to the person and they're having carpal tunnel symptoms as well as the arm pump symptoms, you can do them both at the same time.
Now, Paul, I learned a little bit at the knee of Dr. Bryan at Laguna Seca. So one of the things he told me is we have in each hand, we have 5 fingers. Well, some riders don't, but
they start out with 5 anyway.
Yeah. Blake Young, yeah.
Roger Hayden, but we have 5 fingers if we're lucky, and we have 9 ligaments, or tendons. I'm sorry, 9 tendons. And there's 2 tendons per finger, and there's 1 tendon in the thumb. So this carpal tunnel involves severing a tendon or something. So you have some, I guess, redundancy, or I can see why it affects arms or finger strength or grip strength, because those tendons are what are pulling your fingers together to grip something, or pulling them in, right?
Right. And you get carpal tunnel because those 9 strong rope-like tendons are in the tunnel with the median nerve, which is, kind of soft and fleshy. So if things get tight in there, the tendons aren't going to compress, the nerve's going to compress. So there's a ligament over the top of the tunnel called the transverse carpal ligament. And we divide that ligament and open it up. So yeah, that does serve a functional purpose for strong gripping. But, like I said, most racers, they're so strong to begin with that losing 10% of their grip strength or 10% of their forearm strength doesn't really set them back that badly.
All right, I've got an odd question here, and I hope I'm right, but I never am. I have a friend, and I won't mention any names, but she's constantly cracking her knuckles, right? And I grew up as a kid, and my mom would say, "Don't crack your knuckles," blah, blah, blah. So I tell her, "Don't crack your knuckles," and she laughs at me and says, "Oh, it's good for you to crack your knuckles."
Well, if she's not listening to this podcast, I can tell her Dr. Bryan said, "Don't crack your knuckles," because I find it irritating as crap.
Well,
But
that's it, right.
but it really doesn't do any harm. At least that's what I've been taught. There's just nitrogen bubbles coming in. You create a vacuum in the joint and the nitrogen bubbles pop. You're not really popping ligaments or anything like that. But yeah, it's kind of like running your nails across a
Right.
chalkboard. It's irritating as crap.
Right. Well, I used to be able to do it, but now I think my fingers would actually snap off because they don't crack like they used to. But anyways, I'll tell her.
Yeah, lie to her. It's good.
Now, one of the things we've heard about a little bit, Dr. Bryan, is, we hear in some of these press releases on riders, about the injuries that they get. You hear about things like the scaphoid or some of these things in your wrist or maybe in your foot. These bones that don't get a lot of blood. They're difficult to deal with. If you break them, it's an issue sometimes. What's the toughest surgery that you've ever had to do on any part of a body orthopedically?
Oh, that's a tough one, but
okay. Maybe among them. Give me among them.
Scaphoids are tough. They are tough because the blood supply to the scaphoid, there's not a bunch of vessels that go into it. So the one half of the scaphoid doesn't have any blood supply other than the part that comes from the other part of it. So when it breaks, there's no blood supply to half of the scaphoid, and it can collapse. It's called avascular necrosis. And when that collapses, the whole wrist can collapse. And, that is something that can be a career ender. There are surgeries you can do for it. Proximal rocarpectomy, where you actually take 3 of the bones out. But we try to recognize when scaphoid fractures happen and fix them right away. But I mean, some of the toughest surgeries I've done have been, like open tibia fractures with one particular rider at Fontana who got run over had broken plates and bent plates and broken screws, and they're all sticking out of the open wounds. And, putting that back together without compromising any of the blood supply is not that much fun. But, that's something I trained at LA County USC Medical Center. And, we dealt with a lot of really bad long bone trauma and open fractures. And those can be really tough to put back together. And fractures that go into joints, if it goes into the joint can't be close. It's got to be exact, because otherwise you'll get arthritis in that joint. So that can be really hard too.
So I've got another one I got to drop on you, Dr. Bryan. How many? Okay, Paul, listen, I got to ask him this. This is a phrase you may know about it. It comes up in football sometimes, but I know it happens in car accidents. How many Liz Franks have you done in your time, Dr. Bryan? And can you explain about what a Liz Frank is? Because
I've never heard of it.
I've had trouble understanding it. So yeah, how many have you done? What is it?
Well, I did a lot in my younger days. I have a partner who's a foot and ankle specialist, so okay. They tend to get shunted to him. But Liz Frank was actually a surgeon in Napoleon's army, and he described the fracture dislocation that happens when a guy gets thrown off a horse, but one foot is still in the stirrup. So it basically takes the forefoot and rips it out from the hind foot. So you get the mid portion of your foot has a fracture dislocation pattern. And that's, you have to walk on your feet. So it's a very difficult fracture to fix. And you have to get it, you have to reduce the dislocation. And sometimes there's a fracture involved. Sometimes it's just dislocation. So it's the midfoot. And yeah, it's a very tough one to fix. and patients often have pain for a long time afterwards. So my partner, Dr. Lugo, foot and ankle specialist, and we also have two podiatrists we work with, but we give him the Lisfranc's fractures now. So I don't have to deal with those.
Mm. I've heard about him from a couple of football players. You know, you mentioned Antonio Pierce. I'm a huge Giants fan. I remember there were a couple of Liz Franks on that team. I remember them saying that sometimes can happen in a car accident because it kind of sometimes, like you said, the stirrup thing, but almost it folds your foot. If you get your foot up underneath the dash and you get a compression of the metal in there, or landing on it from being tackled. Does it happen very often in motorcycle accidents?
In street crashes, yes, and hopefully motorcycle boots will minimize that. I think in the car accidents, it happens because you're slamming on the brake and your forefoot's on the brake, and all the force goes up through your forefoot, and it actually dislocates it that way. So I don't think it's as common, or it's not a super common injury in motorcycle racing.
Right. Okay, I know of at least one rider in our paddock right now. I'm not gonna name that names because I don't think I necessarily have to. But that person is walking around with at least a torn ACL and possibly an MCL, maybe in both legs, maybe in one. It still continues to ride. That rider gets their knee down without any issue. Claims it doesn't really bother him that much. How is that even possible?
You know, I actually, I've had both my ACLs done, one from football and one from rugby, but long time ago. But I found actually with several racers that I've taken care of that I've done arthroscopy on their knee, their ACL is either acutely torn or torn a long time ago. And the one thing about doing an ACL reconstruction, you can't necessarily guarantee full knee flexion. You can't guarantee that they'll be able to, flex 135 degrees or touch their heel to their ass. That's not guaranteed. You can ride. The ACL really comes into effect when your knee is extended, which doesn't happen that often. Certainly not on a super bike. It doesn't happen that often. So you don't really need an ACL to be able to race a super bike. And I don't recommend they undergo an ACL reconstruction during their career as a road racer, because it's not something that you need, and it's something you can end up with not enough knee flexion to be able to race effectively. So I don't recommend ACL reconstructions in superbike racers.
Wow, that explains that, because I like I said, I know some that have told me, no, I'm not going to worry about it till later on. And I'm like, how the heck can you even walk around? Because I don't know I don't know the orthopedics of this, but I've watched enough football to see this happen where these guys will get up and they'll start walking off the field, and all of a sudden you'll see their leg does something. It's like they've lost something that is even stabilizing that leg to stand up or walk normally. What is that going on?
Well, when you first do it, you're unstable. And what I've found is that I do a lot of ACL reconstructions on my football players, but they learn with their hamstrings and other muscles how to brace against it. So if I examine someone on the field right after it happened, it's really easy to tell they got an ACL tear. But if someone is 2 weeks out, they'll be splinting with their leg muscles, and I won't necessarily be able to tell without an MRI scan whether their ACL is torn or not. And I've built hundreds of knees, obviously, but you muscles can learn to make up for not having an ACL for most things. Obviously, cutting and those types of activities are a little bit different. But riding at least a sport bike, not necessarily riding a dirt bike, but riding a sport bike, you don't really need an ACL for that.
That's amazing to hear that. I really didn't know that. Now that explains that for me. I'm not going to feel so bad for those riders. Well, maybe I still will, actually.
Well, there's at least one that when he retires will do it so he can play football with his kid. Things like that. That's already like in the offing, but that's not during the career.
So I've had a couple here, Paul. I got to ask Dr. Bryan about that. This is a weird deal. I live in fear of something happening to me just by walking around, because I've heard it gets more prevalent as you get older. I'm always afraid I'm going to rupture my Achilles tendon. Like, is that going to happen? I mean, what happens?
Well, old dudes playing basketball rupture their Achilles. That does happen. My physician assistant actually ruptured his Achilles, and I had to fix him good, because anything he couldn't do, I had to do, right? So I had to make sure he got well very quickly. And yeah, he had a good result. But yeah, the Achilles can rupture. And, I think stretching before, during, and after activity, especially the older you get. And this is do as I say, not as I do, because
I hate stretching.
I hate stretching too, but really that the sudden stretch of your Achilles without warming up is the thing that really makes it go. So, you know, that's they are fixable. We have better systems for fixing Achilles now, but you know, it can still happen. And yeah, guys are shocked when it happens, you know. That's they don't expect it. And
Yeah, and
it's with relatively minor activity sometimes.
does it become more brittle as you get older, or am I wrong about that?
No, it does. It does.
Okay. Okay.
Everything does.
Yeah, exactly. It does not. Yeah, things don't. I don't bounce like I used to either. You know, that's
Yeah.
I'm used to that.
Okay, another one I want to ask you about, and this is another thing that happens as you age, but you've probably seen this in riders that have been injured or patients that you've had that aren't older. What do you see, what do you see with arthritis, and how do you deal with it?
Well, there's two kinds of arthritis. One is like an autoimmune rheumatoid arthritis, and we usually deal with post-traumatic arthritis. And you can do total joint replacements later on down the line. We usually deal with it with keeping your muscles strong, losing weight, and you can inject with cortisone, but not too much cortisone. There are some gels you can inject. Whether they work or not is controversial. Platelet-rich plasma injections, once again, no one knows exactly how they work or when to do them. There's also stem cells that are, I think, being oversold. Guys' wallets are being emptied to pay for it because it's not proven. I haven't seen huge results from it. So I wouldn't, don't dip in your pocket and take out $10,000 to pay someone to inject stem cells into you. It's just not worth it. But yeah, I mean, one of the main things is if you have an intra-articular fracture, when that goes up into a joint, you make sure that they fix it perfect. So it's not, there's still going to be some injury to the cartilage, but you make sure that you're not going to leave an uneven surface that's going to wear out the surface opposite it.
Okay, this isn't bone related, but it's health related. I don't have to say any names because he's on the screen right now. But does drinking huge amounts of Mountain Dew Diet Mountain Dew, is that something that's good for you, Dr. Bryan? Would you recommend that to somebody that's on this TV screen right now?
Well, I'm a Diet Coke addict, so maybe.
Oh, oh no! There goes my argument.
Huge amounts of sugar are not good for you, and whether certain foods have inflammatory components that lead to arthritis, there probably are, but exactly how and when, I'm not the expert on. And your thing called the body mass index, which is just a real basic thing of how tall are you and how much do you weigh. And obviously someone who's a block of muscle is going to not count compared to someone who has no muscle and is just fat. But as a general rule, we like to have people keep their BMI under 30 and really under 25. But so drinking a lot of sugar is you're going to put on fat. You're not going to add muscle. You're just going to add fat. And that's so, as a general rule, no, it's not good for you. But caffeine is something that I'm addicted to. And, I think, hate to say it, probably most surgeons are addicted to caffeine because from our younger years, they get you out of bed at 2:00 in the morning to fix an accident. You better pound down some caffeine because otherwise you're going to be a little sleepy.
Right.
Yeah. And it's funny too. The primary care physician I have, I always try to specify, oh, it's Diet Mountain Dew. I'm drinking NutraSweet. And she goes, it's still sugar. I mean, she tells me it's just fake sugar.
It's maybe worse for you, actually. The diet,
right.
Like a chemical.
But and your body, if you flood with insulin and it does not necessarily help you lose weight. You're better off drinking water or a mild electrolyte solution.
I can't get him to drink water.
I hate water.
Pounding down monsters is not necessarily good for you. That's
right. Yeah, I don't do, but I think Diet Mountain Dew is pretty much just as bad. Another this is a little bit because of, I think, age, but it's a prevalent thing nowadays, even among young people, and it's testosterone. Do you recommend that to older people, to younger people? Do you recommend any of it?
No, there are some biosimilars and things that that are probably okay, but testosterone has side effects. And, I've had one patient that, got some testosterone that was kind of had other things in it, and he grew little boobs from it. So he was no longer shirtless at the gym after that. I mean, so that's the thing. It's kind of like, what are you getting? So if a doctor prescribes you testosterone for a medical indication, okay, that's fine. That's between you and your doctor. But as a general rule, don't buy the steroids from some guy at the gym because he's bulked up and you want to get like him. That's not something you should do. That's not safe.
Yeah. So here, Paul, you may have seen this or heard about this. I mean, we know what happened with Cameron Beaubier at Road America. And he's there and he's like talking about, yeah, man, I got to go see my doctor, Dr. Bryan, we knew. And I come out of the media center and there's Dr. Bryan walking to one of the VIP suites. He's at the track. I mean, Dr. Bryan, what were you doing at Road America? Were you there for just your own enjoyment or what was going on?
No, I was there for my own enjoyment. My daughters live in Lake Forest, Illinois. My brother lives in St. Louis. He came up, and my brother had never been to a MotoAmerica race. He's a gynecologist, actually. So
okay.
Don't really need him at the MotoAmerica race. But so I took him to the race, and it was raining, so I didn't really see everybody out in the paddock like I usually would because running around in the rain, no one was around anyway. So I had not seen Cameron. I don't think he knew I was there.
Right.
That's funny.
Yeah. I don't think he did. And I didn't either until I knew I saw you and I didn't even say anything to you. I just saw you from a distance and I was like, am I seeing things? But you're right. You had told me you're from Illinois. So that makes complete sense. So, but I mean, it's cool. You actually are a racer, a motorcyclist, and a fan of our racing. And in talking to you, it's amazing how you can tell us about so many riders, a lot of times or sometimes off the record because we can't really talk about it, but it's incredible. Do you know how many riders you in our paddock, either in past history or now you've worked on just as a number?
Probably 25.
Okay.
And sometimes I just consult or they'll send me the x-rays and say, what do you think? And things like that. I don't necessarily make them fly out to see me. So maybe even more than that when it comes to looking at x-rays and things.
And there's probably 10 who are regulars.
Well, I have some frequent flyers. Yeah. And it's documented. Cameron Beaubier among them. I mean, I've operated on, all four extremities with him. And but obviously he recovers pretty darn well and he's pretty darn tough. And, that heel fracture that I fixed, that worked out real well for him. And
so far so good.
Yeah.
Is it true that he has a punch card that he just, you punch it whenever he comes in and he's going to get maybe a bouquet of flowers at some point? Or
well, we did have when COVID first hit and the season was delayed, Cameron came down for a surgery, and we weren't supposed to be doing elective surgery, so I might have made an exception.
There you go.
I made an exception for one of our GI doctors that couldn't do endoscopy, and he really needed total knees, so he wasn't able to operate anyway. So I snuck him in for emergency total knee replacements. So it wasn't just my athletes that I made exceptions for; it was also
perfect.
Wow. Well, I'll tell you, this has been fascinating. We're running out of time. We'll have to have you on again. And would you do that for us? Because I mean, I have never ending questions and, it's just, we all have bones. We all have issues that we wonder about, but we see our riders and wonder, like, how is that person getting back so soon? And it's good to know that we've got somebody like you that, does the right thing and gets them back quickly, but also gets, their quality of life later on for them. You value that as well, clearly. So it's great.
And also, Sean, this doesn't count as like your yearly physical that you have to
I saw the doctor. No, he saw me at Laguna Seca.
I did. I've been to him twice now. So
he's been to me twice.
Yeah, that's right. But no, thank you.
Dentist, I see the country club and okay, I saw the dentist. It's okay.
That's perfect.
Yeah, no, this is great, Dr. Bryan. Thank you so much.
Yeah, thank you. And we'll see you down the road. And hopefully for all the right reasons.
For the right reason, not as a patient.
No.
Please.
No. Okay, thank you guys.
Thanks. Bye.